We here at Ebenezer Baptist Church, we are considered to be the church that reaches out, and that is our motto here. So whenever we can do anything to help the community, we try to get involved in it. And so when I heard about this program, I felt like it would be something great for us to be involved in. So to see the setup and to see the amount of people who are coming through, it was a blessing to see and be able to help those who needed dental care who couldn't afford it otherwise.
Well, the Giving Hand Foundation was started about 10 years ago. We carry portable dental equipment up and down the East Coast to various facilities like this where we find a host that will recruit patients from homeless shelters, battered women's shelters, church groups, all sorts of things that wherever there's needy patients, we try to go to those patients. And the Giving Hand Foundation has made this all possible by helping to provide the equipment in conjunction with the LD Pankey Foundation in Miami. We've been doing this. We average providing about $1,200 worth of free dental care to each patient we see, and we'll treat about 100 to 120 patients over the next 2 days.
Well, I've been volunteering for about 4 years. Almost 5 years. I started when I was in the dental assistant program in 2006. And just the feeling that I felt after, I was exhausted after a day's work, but the smiles people had on their faces and they were so grateful that it was an overwhelming feeling for me, and I was addicted. I'm like hooked to it now. And now I'm the clinic coordinator for this Pankey Institute, Giving Hands Foundation clinics who up and down the East Coast, mostly North Carolina, where we're from, but a couple times in Virginia. So yeah, I absolutely love it, and I recommend anybody doing it.
Our organization started about 9 years ago when my wife and I felt God's call to help people that were poor. So we went out to the oceanfront of Virginia Beach and began to give out sandwiches. Gave out the sandwiches to like 5 people, and our organization's been growing since then. So what we do every Sunday, we have we serve a full meal dinner to about between 200 and 250 homeless people. We provide medical care. We have volunteer doctors and nurses that come in to provide free medical care. We provide hygiene supplies, clothing, and also food. Sorry.
Okay, so do y'all just pick up random homeless people that y'all see?
No. We actually have a church called Beach Pentecostal down at the oceanfront that lets us use their building, and there's a lot of homeless people that live by the oceanfront because it's a tourist place, and so there's probably within the region of the oceanfront, within 15 miles, there's probably about 300-400 homeless people, and so they know where we are because we've been around a long time. The key thing for our organization is the relationships. So it's not the services. The services are just a means to get to know people. So ultimately, what we do is we bring people in, we become friends with them, and then in turn we provide services for them. I mean, really, the question I would ask you, Jaquan, is if you had a friend who was hurting, would you help him?
Yes.
Why?
Because he needs the proper care from a friend.
That's right, because he's your friend.
Yes.
He's your friend. He's not a total stranger, and so that's the same thing with us. We build those relationships, and through those relationships, provide services. We also, to share with you also, we also have a pancake breakfast every Saturday morning followed by recovery groups, and we own 3 mobile homes, and we lease 2 houses from the city of Virginia Beach that we use to put families in. And so those 5 houses are full right now.
Okay, I would like to thank you. here at this volunteer center, a clinic, if you want to call it?
Well, as I had told you before, I was an emergency department nurse for 13 years and loved helping patients. But what I found is a lot of people that don't have access to health care come to the emergency room because it's really the only place that you can go that you don't have to pay. They can't refuse to see you because you can't pay. But it's not the best place to receive services. It's best to have a primary care home and someone to manage your care and refer you to the appropriate places. But on this occasion, as far as the dental outreach goes, what we're finding is more and more people have dental needs, and your dental health affects your overall health. So if you have an infection in your mouth, it's going to go into your bloodstream, and it could. We had the child in the newspaper a few years ago that died from an abscess tooth. So our excitement is to be able to bring the dental services to people that need them.
Okay, so what kind of organizations do you all help during this clinic and outreach to the people?
Okay, I work, I'm serving as Executive Director for Access Partnership, which is a community collaboration, and our whole focus is improving access to health care, including dental. And we work with the Oral Health Improvement Coalition, which is a group of volunteers that are working to improve dental access. So what we did was we notified the area agencies that are serving the low-income, uninsured people that don't have any resources and wouldn't be able to see a dentist otherwise. So as far as today, we have patients coming from the Union Mission, 4 Kids, Penn Ministries, Samaritan House, Judeo-Christian Outreach Center. This one was focused a little more on Virginia Beach because Virginia Beach has no dental clinics. So this one today, we're seeing agencies. We also have an access line, a dental access line. It's called, it's 857-8500, I'm sorry, 853-8500, extension 127. So when they call that number and leave their name and their contact information and tell us, you know, I have a toothache or I have an abscess or I need to see a dentist, then we return their call. If we're having an upcoming dental outreach, we schedule them to come in. If we don't, then we have a list of all the dental safety nets that we refer them to a dental clinic or somewhere in our community that can serve their needs.